Our first movement we have is flexion. Flexion is bending the parts at a joint so that the angle between them decreases and the parts come close together. It's performing flexion at the knee joint. Then we'll come to Geo, who's performing the extension movement at the elbow joint. Extension is moving parts at a joint so that the angle between them increases and the parts move farther apart. Now we'll come to Brant, who's performing a combination of supination and pronation. Supination is rotation of the forearm so the palm is upward or facing anteriorly, and pronation is the rotation of the forearm so the palm is downward or facing posteriorly. Geo is now performing the movement circumduction in the shoulder joint. Circumduction is moving a part so that its end follows a circular path. Now we have to get the bands. The next movement we're performing is dorsiflexion. Dorsiflexion is movement at the ankle that brings the foot closer to the shin. And if we flip it around, we have plantar flexion, which is the opposite. The movement of the ankle that brings the foot farther from the shin. Okay. The next movement is inversion. Inversion is turning the foot so that the plantar surface faces medially. And the opposite is eversion, which is turning the foot so the plantar surface faces laterally. The next movement is a combination of abduction and adduction. Abduction is moving a part away from the midline or from the axial line of the limb, and adduction is moving a part toward the midline or toward the axial line of the limb. We have rotation. Rotation is moving a part around an axis. Medial rotation is turning a limb on its longitudinal axis toward the midline, and lateral is the other way. And the last movement that we have is opposition, which we couldn't find a workout for, which is pinky to thumb.